Have you ever wondered if gluten's a problem for you? Hi, I'm Luke from Active Health Clinic, and just this morning actually a patient asked me why, even though she's reduced gluten and gotten a negative celiac test, that gluten-containing foods seem to be more of a trigger for her gastrointestinal symptoms than ever. This is a really interesting concept, and it's something I've heard from a lot of people in the past, that they've reduced gluten or cut gluten out of their diet without sort of anyone else's input, just because it's something that's been suggested that might make them feel better. And then when they've attempted to just have little bits of gluten-containing food here and there, their symptoms have, for lack of a better way to put it, gone through the roof. This is something that's actually quite common, and it's because of a thing that we like to call tolerance. And this is an idea that says that when we actually reduce a food out of our diet for a perceived or real symptom that we're experiencing, that when we try and even just implement little bits of that back in, it causes lots of trouble. But the question is gluten actually the problem, or is there something else going on that's really causing or triggering these symptoms? And I'd like to tell you about a couple of other reasons why that might be happening. These symptoms might be arising with just those little bits of gluten-containing foods today. There are two other factors to these foods that are commonly looked over, and the first is actually wheat itself. So obviously when we think about a gluten-containing food, most of them are wheat-based, and there are many other flours and grains that have gluten in them, but wheat's the most common. And sometimes, very rarely, people can actually have adverse reactions to wheat, and they can be intolerant or even allergic to that wheat grain. The second thing that people don't think about is one of the FODMAP carbohydrates, which you can find out more about in my other videos, but it's known as a fructan. And this is quite commonly found in these gluten-containing cereals and grains, and also in certain vegetable families like the family that contains onion and garlic. And this is very known to create those gastrointestinal symptoms that are similar to what people with celiac disease describe getting from gluten. So these are the other things that we need to keep in mind. And wouldn't it be nice to know what was actually the cause of these gastrointestinal symptoms and why they become so apparent after we've reduced these foods out of our diet? Well, today I'd really like to tell you that there isn't a really, not necessarily simple, but clear route that we can go down and use to identify what the cause of these gastrointestinal symptoms are for you, and whether they come from gluten itself, the wheat, or the fructan component of this grain. And today I'd like to share with you two tips and tricks to keep up your sleeve when you're on this journey. And obviously this is going to be individual for everyone, and you'll need to get your own personalized advice on this journey. But these are two things that are pretty universally accepted as to what we need to look out for when we're trying to decipher where these symptoms come from. The first is that when you go for a celiac screen to your doctor, you need to have gluten in your diet. What you're getting when you get a celiac screen from your doctor is a blood test that measures the antibody count that your body produces against gluten when you have celiac disease. If there's no gluten in your diet, then your body's not producing the antibody, and you'll have what's called a false negative to this test. So it's really important to make sure that if you are going to get a celiac screen, that you've got at least 4 pieces of bread's worth of gluten or wheat or other gluten-containing grains in your diet per day for 4 weeks before you go and get that test. The second thing to remember is to actually look at where the symptoms are appearing. So with gluten, they are very gastrointestinal based, and they will happen really promptly around when you eat gluten-containing foods. If it's more wheat-based, the chances are that it might appear more like a allergic reaction with sub-anaphylactic-like symptoms like skin rashes or maybe a little bit of trouble breathing. And if it's a fructan, it will be very similar to that gluten complaint that we get with those gastrointestinal symptoms, but it won't just be around those wheat-containing foods. There will be other foods that actually trigger these symptoms as well that aren't wheat or gluten-containing. I gotta run now, but I hope this video has been really helpful to identify and talk about some of the reasons why these foods seem to trigger such a really harsh reaction. If you found this helpful, please like this video, share it, subscribe to our YouTube channel, and get on board because we share content like this all the time. At Active Health Clinic, we're trying to impact 1 million people by 2022 with invisible illnesses, and we'd really love if you could help us in this process by getting on board with these videos. Thank you and happy eating.